Yeah, CyberKnife is much more targeted than conventional radiation, not only because it can shoot from hundreds of different angles, but also because it tracks. So like in a brain, it tracks any subtle motion by skull anatomy. In a prostate, we have little gold markers in the prostate, and the prostate moves around, and we track its motion and adjust for it. So for certain types of tumors, say prostate, it's only 1 week. It's 5 short treatments as opposed to 7 or 8 or 9 weeks. People tend to tolerate it better than a longer course of radiation. And it's highly effective. The higher dose per day does a better job of killing the tumor than multiple small doses, particularly prostate. For lung, we typically treat a stage 1 lung cancer or a lung metastasis in 3 treatments. So the dose we give in 3 treatments is the same that conventionally we would give over 6 weeks, but we're doing it in half a week. And so the biologically effective dose is enormously higher than with conventional radiation, so we do a much better job of killing the tumor. Over 90% of the time, what we hit with CyberKnife is killed off. But we have to continue to monitor to look for other areas where the tumor can appear, but it's highly effective. We're now doing a lot of breast cancer, stage 1 breast cancer. If it's less than 3 centimeters with negative margins and negative nodes, the risk of having it recur somewhere else in the breast other than right where it was is very low. And so we essentially just treat where the risk is, and that's for the tumor bed with the 1 centimeter margin around it. We shoot that 5 times in 5 consecutive days, 12 minutes. Very easy. We've done about 300 women that way now on our new CyberKnife, and the results are excellent. There's a 10-year study that compared whole breast versus the accelerated partial breast, equivalent outcomes with less toxicity with the targeted therapy. The CyberKnife's a great machine to do that on. So rather than treat all of the whole brain of all of the side effects such as headaches, nausea, hair loss, long-term cognitive issues, we just treat the one spot, and we spare all the normal tissue. We spare those side effects that come from treating all that normal tissue, so we just hit where the risk is. And the dose we give in 1 treatment is actually higher than what we give over several treatments conventionally. So again, that spot has a very low chance of coming back once we hit it. It's gratifying to help any patient, but particularly ones that you know them prior to being a patient. It's there's a lot of, in some ways there's pressure to ensure a good outcome, and it's very gratifying when there is a good outcome.